Who is the best person to treat my follicular lymphoma?
Most of the time, follicular lymphoma is treated usually by hematologist oncologist. Many centers have specialized doctors that treat certain types of lymphomas, and so have a little bit more expertise or experience in treating follicular lymphoma. But many general hematologists or oncologists, because follicular lymphoma is one of the more common lymphomas, do see a fair amount and will kind of have a lot of expertise in all the different follicular lymphoma treatments. The other people that we sometimes involve with follicular lymphoma and both in the, kind of early stage setting, talking about trying to cure follicular lymphoma, or very specific settings where we just want to treat kind of one area of follicular lymphoma. Sometimes radiation oncologists are very important parts of our treatment team. And especially through the pandemic with trying to avoid many immunosuppressive therapies, as we came up with really good, I think, creative schemes with, low-dose radiation to try to get patients through and keep their immune systems as intact as possible to avoid complications of COVID-19. So I think if someone told me, who should, be treating or ideally following their follicular lymphoma, I think, I think it ideally is a physician or provider that the patient, trusts and has good rapport with, that they're comfortable going to that particular center, and that physician or provider, is comfortable thinking about all the different kind of trajectories and treatments for follicular lymphoma patients, and at least has ideas of and access to, all the different modalities that may be available. I think the other thing that is always good is to consider clinical trials in these diseases, and many of the time that's in specialized centers, but I think that's just a patient-specific sort of feature in terms of getting the best follicular lymphoma care.
When a patient is diagnosed with follicular lymphoma, it's important to see a lymphoma expert, a person who only treats this disease and has the experience to treat these patients, and also the access to clinical trials. As we mentioned, follicular lymphoma, by definition, is not a cure of disease. However, different new agents have been developed over the last couple of years, such as CAR T cells, bispecific antibodies, and that are achieving very good responses. So it's important to see a doctor, a physician with the knowledge and the ability to provide these therapies if it's needed.